Post-traumatic stress disorder, or PTSD, is a serious mental health condition that can develop after experiencing or witnessing a terrifying event. These events, often referred to as traumas, can range from physical assaults and natural disasters to car accidents and war. Anyone can develop PTSD, regardless of age, background, or resilience. It is not a sign of weakness. Rather, it's a normal human response to overwhelming experiences. Many people experience trauma in their lives. You might feel afraid, anxious, or even numb after a traumatic event. These feelings are natural reactions to extreme stress and are usually temporary, fading with time. However, for some, these feelings persist and even worsen, signaling the onset of PTSD. It's important to remember that PTSD is a medical condition, not a character flaw. First responders, veterans, and survivors of abuse are particularly vulnerable. With the right support, healing and recovery are possible. PTSD develops when the body and mind fail to process a traumatic event properly. Normally, after a stressful event, the body returns to a state of equilibrium. However, in PTSD, the nervous system gets stuck in a state of high alert. This leads to a range of physical, emotional, and behavioral changes. The symptoms of PTSD can be diverse and vary from person to person. They typically fall into four main categories. First are intrusive memories, which can include flashbacks, nightmares, and distressing thoughts related to the trauma. The second category involves avoidance behaviors. Individuals with PTSD often try to avoid anything that reminds them of the trauma. The third category encompasses negative changes in thoughts and mood. Lastly, individuals with PTSD often experience changes in physical and emotional reactions. These changes can make it challenging to navigate daily life and maintain healthy relationships. PTSD is more than just a collection of symptoms. It's a complex condition that can significantly impact every aspect of a person's life. The constant state of hypervigilance and fear can make it difficult to concentrate, maintain relationships, or even leave the house. This can lead to feelings of isolation, hopelessness, and despair. The impact of PTSD often extends beyond the individual. Family members and friends may struggle to understand the changes they see. They may feel helpless or frustrated, unsure how to support their loved one. Untreated PTSD can have serious long-term consequences. Individuals with PTSD are at a higher risk for other mental health conditions. Recognizing the profound impact of PTSD is crucial for both individuals and society. Early identification and intervention can significantly improve outcomes and help individuals reclaim their lives. Recognizing the signs of PTSD is the first step toward recovery. It's important to remember that PTSD can manifest in many ways. The symptoms can be subtle and easily mistaken for other conditions. If you're experiencing distressing symptoms following a traumatic event, don't hesitate to seek professional help. It's common to feel ashamed or embarrassed about experiencing PTSD. You might worry about being judged or misunderstood. Remember, PTSD is a medical condition, not a sign of weakness. Talking to a trusted healthcare professional can provide clarity, support, and a path towards healing. There are many ways to find help for PTSD. Therapists, psychologists, and psychiatrists can provide a proper diagnosis and recommend the most effective treatment options. Taking the first step towards seeking help is a courageous act of self-compassion. Overcoming PTSD is a journey that requires a multifaceted approach. The good news is that effective treatments are available, offering hope and healing to those who seek them. Therapy, medication, support groups, and self-care strategies can all play vital roles in recovery. One of the most effective therapies for PTSD is cognitive behavioral therapy, or CBT. CBT helps individuals identify and change negative thought patterns and behaviors associated with the trauma. Medications can also be helpful in managing PTSD symptoms. Support groups provide a safe and supportive space for individuals with PTSD to connect and share their experiences. Self-care is crucial for managing PTSD symptoms and promoting overall well-being. Engaging in activities that bring joy and relaxation can help regulate emotions and reduce stress. Prioritizing sleep, eating a balanced diet, and engaging in regular physical activity are also essential for supporting both mental and physical health. Recovering from PTSD is possible. While the journey may be challenging at times, it is essential to remember that healing is within reach. With the right support, individuals with PTSD can move beyond the darkness of trauma and embrace a brighter future. Recovery from PTSD doesn't mean forgetting the past. Instead, it's about learning to manage the emotional and physical impact of the trauma and integrate it into your life story. Through therapy, medication, support, and self-care, you can develop coping skills, regain a sense of control, and rediscover hope. Remember, you are not defined by your PTSD. You are a survivor, and your strength is an inspiration. Embrace the journey of healing, seek the support you deserve, and never give up hope. There is life beyond PTSD, a life filled with hope, joy, and meaningful connections.